Visually licensed professional counselor with the state of Mississippi. I'm also a volunteer with Arden Hospice, and myself and my therapy dog Titus will go out and do visits when patients request some puppy therapy, and it actually works really well. I'm here today to talk to you about bereavement and grief and a lot of the anxiety that goes along with these processes. So first we'll start just kind of explaining the definitions. Bereavement is a time period from the time you receive a terminal diagnosis through that time period until the patient actually passes away. And then 1 year after that is all considered a part of the bereavement process. It's more of an external thing. It's the process you go through, all the different things that have to happen when you're going through this time frame. Now, grief is the internal process, how your body reacts to the loss. It is, there's several stages and there's several types of grief. Acute grief is that initial grief where you may have crying, you may have upset, may have anger, all these different things that go on when you're getting that initial diagnosis. And sometimes even when the person does eventually pass away, when it really sinks in on someone that they've passed, they'll have acute grief. The goal is that, it's normal, it's natural to go through that. And then you work your way toward integrated grief. The integrated grief is when you go through the 5 stages, which they're not in a particular order, but they normally go in a fairly good order. The first stage is denial. That's when a patient might receive a terminal diagnosis, and either the patient or family members might just really not want to believe that this is what's happening and this is the time frame. And here's all the things that are going to happen in the next 6 months. And it's normal to be in denial. And then they might go to anger. And they may get there pretty quickly. You never can tell. Sometimes they'll be very angry. They may be kind of a little aggressive toward the staff or toward each other, that kind of stuff. And it's not an unusual thing. They're working their way through the grieving process. Then you go from anger normally to bargaining. Bargaining is when you may be thinking, hey, if I, start eating better, if I stop smoking, if I, you start looking at all these alternatives of things that you might could do that, would help. There becomes a point when you kind of get through bargaining and you start to realize that this is happening, and we need to focus on what's the best things we can do for the actual patient who's received the terminal diagnosis and those caregivers. So at that point is when you go, the phase of depression hits, and then you'll work your way through depression, and then you get to the point where you're accepting everything. And, we really grieve. It never really ends. I mean, even, my dad died 15 years ago. I still sometimes, when I'm doing something, working on something that I know he would have been excited about, I still think about calling him or being able to show him because of the fact that memory pops back in there. And I still think about how proud he would be of something I've done or how funny he would think it would be. So grieving doesn't really ever go away. The goal is just to get it to the point where you grieve in a healthy way. Now, 90% of people will move right through the stages, and there is no wrong way to grieve, and there is no specific time period, and they will move their way through the phases, acceptance, and then, be able to go on and have a normal, productive life. About 10% of the population will struggle to get beyond the acute grief, or they will just stay in a certain phase of the actual integrated grief, and it really does impact how they live their life and the quality of their life. And those people might require the help of a counselor or therapist, somebody like myself, to help them work their way through the process and help get them through to where they can accept the process and go on and have a productive life. And that's the goal. I mean, the goal as you go through this is to make it as easy as possible on the patient and make it easy as possible on the caregivers and the family. And one of the big parts of this is why it's so important to have a good hospice nurse and comes out and explains, the disease process, how the medications work, what you should be expecting in each one of these different phases. When we don't know or we're uneducated on something that's happening, a lot of times our mind can just go all kind of places that are not good for us. So sometimes if we know that, hey, this is my disease process, here's the phases, here's the medications that we're using, here's what results we should get, here's when you need to call the nurse, and here's when this is pretty normal. As you're working through that process, it just makes the stress level lower. Even the patient themselves, knowing that these are the next phases and that they don't panic, they just realize, okay, I'm going into this phase. It can make it a lot more peaceful process to go through. It makes it easier on the family so that those last days, months can be quality, more quality versus, panic and drama and a lot of pain. And it can also, can make the grieving process a lot tougher when you don't realize what's happening and, you're getting overwhelmed. So now there are a few things that we do if you're getting overwhelmed. And it's pretty normal if you're going through acute grief, or even there'll be certain stages when you're in integrated grief where you might feel like you're overwhelmed. And so I'm going to give you a few tools to put in the toolbox that you can use when you're faced with this. First one is a breathing exercise. It's called eye roll. When you're growing up, if you rolled your eyes, you got in trouble. But this is a good one. And the nice thing about it is the fact that no one necessarily has to know you're doing a breathing exercise because it can look fairly natural. Now, the goal is as you'd sit down, you take a deep breath, hold it for 5 seconds, and you roll your eyes up. When you breathe out, you hold it for 5 seconds and you roll your eyes down. Now, if you do that 6 times, that's 1 minute of a breathing exercise, which gets a huge amount of oxygen into your system and actually really does help to relax you. Now, you wonder, why am I rolling my eyes up and why am I rolling my eyes down? Well, you can't literally take that breath in or take that breath out and roll your eyes up and roll your eyes down without thinking about it. When you think about it, it actually gets you out of your mind. It gets you off the neural pathway where you have a lot of the stress and anxiety associated. So it actually helps relax you in 2 ways. One, you get a lot of oxygen in your system. And 2, it gets you off that neural pathway that's causing you a lot of stress and anxiety. Now, the next tool, and a lot of times it works really well in conjunction with the breathing exercise, is called the calming place. Now, when we do our calming place, we think of the most beautiful, calming, relaxing place that we've either ever been, seen on TV or movie, or even read about. This place is a place that you can imagine in your mind. You're totally in control of it. It's the time of day you want. It's time of year, whatever you want to be there, because this is your calming place. Let's say we're going to the beach, and that's our calming place. Then we close our eyes and we sit there and we think of 5 things that we can see. So we might be sitting there, we'd say, okay, I can see the water, I can see the sun, I can see the seagulls, I can see the sand, and I can see children playing. Then you go to 4 things you can hear. Well, I can hear the waves, I can hear the breeze blowing, I can hear the seagulls, and I can hear children playing. 3 things you can smell. I can smell the suntan lotion. I can smell somebody's cooking some food. And I can just smell that ocean breeze. I can smell that nice clean air. And next one is 2 things you can touch. So I can feel that wet sand coming between my toes, and I can feel the water lapping up on the top of my feet. And then the last one is something you can taste. So favorite beverage, which might be like an ice cold Coke or Dr. Pepper or pina colada, whatever it is that you would think of. The nice thing about being in your calming place is it doesn't have to be healthy. It can be just whatever you would enjoy if you were sitting in this calming place, in this perfect environment that you totally control. Now, if you've had your eyes closed this whole time and you've asked yourself those 5 questions, which are your 5 senses, you should be pretty relaxed. Your brain can only be on one neural pathway at a time. So if your brain is on a neural pathway that is a calming, relaxing place where you're literally on the beach, or it could be on the mountains, wherever your calming, relaxing place is, then your brain is not on the neural pathway that's causing you all the stress and anxiety. This is a very relaxing process, and it's a really good tool to have in your toolbox. So we've talked about eye rolls, which is a breathing exercise. We've talked about calming place, which is a calming exercise, or what now they call mindfulness. And the next one is what we call tapping it out. I'm also an EMDR therapist, eye movement desensitization reprocessing therapist. And what we do is we use a lot of the things that your brain uses while you sleep. When you're sleeping, you get into rapid eye movement, which is REM sleep, which is the deep sleep that really helps you to be rested when you get up in the morning. So a lot of us have went to sleep at night really worrying about something. We wake up the next morning, all of a sudden we're at peace with it. A lot of time that's because during our REM sleep, our brain has processed it, moved it from our short-term memory to our long-term memory, and we kind of have peace with it. We're actually feeling pretty comfortable. So we use that and we call it tapping it out. And tapping out is something that you can do. So you could have done your breathing exercise. You could have went to your calming place And now you can be sitting there, and when you're thinking about kind of what you're worried about, you can do what they call bilateral stimulation, which is alternating tapping on each side. Now you can do it on your knees, you can tap on a desk. I mean, there's a number of ways of doing it. The bilateral stimulation makes your brain, the right and left hemisphere, communicate back and forth, naturally lowers your anxiety, much like what happens in REM sleep, much like what happens if you go for a walk or you go for a run. Now, the faster you tap, the faster it processes. The slower you tap, the slower it processes. Sometimes if we're trying to think about something really good and we want it to be prominent, some of those good memories that we have of that person, then sometimes we tap slowly. So we've went over, some tools that you can use if you start getting overwhelmed, which is eye rolls, calming place, and then tapping it out. So these are all tools that can help you if you're struggling and getting overwhelmed. All of us, as we're going through the grieving process, even nurses, aides, family, all of us can get overwhelmed at times. That doesn't mean we're not grieving well or this. It just means there's sometimes we get overwhelmed by everything that's going on. We might even get overwhelmed with like positive feelings and just the fact that you're able to share this time and share these memories with a person. And sometimes you still have to sit down and process through some of that anxiety. So those tools really do help lower your anxiety level. And, anytime you're going through this process, you want to make sure you stay hydrated. You want to eat well. You want to try to get some sleep. A lot of times understanding what's happening and not having all these surprises coming around, having a nurse or somebody that you can communicate with that you feel comfortable with, and then a supportive family structure if you're a patient. It's actually, the goal is to make this as peaceful and positive a process as we can for end of life, so that those last moments, last weeks, last days, those kind of things are as positive and as good as possible. And this also helps a lot with the grieving process, when we're able to make this as positive an experience as possible. Thank you. Now, if you have any questions about anything, just feel free to reach out. It is normal to go through these processes. There's nothing wrong. There's no wrong way to do it. And there's lots of people out here that are here to support you and help you. Thank you. Once again, I'm Tim Patterson. I'm a provisionally licensed professional counselor in the state of Mississippi, and I'm also a volunteer with Arden Hospice of Mississippi. Thank you.